So, May, whenever you're ready, you can start.
Hi, everyone. My name is May Al Ibrahim. Thank you so much for joining on a Saturday afternoon to learn about pharmacy. Just a little bit introduction about myself. I'm a fourth year pharmacy student. I'm about to graduate in a couple months from now. Currently live in Illinois and I go to Roosevelt University College of Pharmacy. And without further ado, let's get started. So just a little bit of intro about myself. I am not originally from Illinois. I grew up in Michigan. I came here about half of seventh grade. I went through high school, undergrad, and then grad school. Decided to move out to Illinois for school. Played tennis in high school. Got a technician job when I was 18 years old, as soon as I graduated high school. Of course, I didn't know anything that I wanted to, I didn't know what type of major or field I wanted to go into at that point, but I knew it was healthcare. So I decided to get a job as a pharmacy technician at 18. I went to Wayne State University in Michigan for undergrad school, finished all my prerequisites there, got really involved in, and I know this is not a popular opinion, but organic chemistry was one of my favorite subjects. So got really involved in that, started tutoring students with organic chemistry, did really well. And I guess some of my hobbies or interests, I did also teach Zumba on the side, really enjoyed music or poetry. And then, through all the 3 years or 4 years of undergrad, I decided to apply to pharmacy school and made a choice to choose Roosevelt University in Illinois, which is a 3-year accelerated program. And I started June of 2018. So my journey to pharmacy school, it started with a whole lot of confusion. I didn't know what I was doing in terms of the major, but again, I always had a passion for healthcare. I was interested in the sciences of it all, biology, chemistry, pathophysiology, anatomy and physiology. So I knew that I saw myself there. It's good to know what you don't want in the beginning, or what you don't see yourself doing, so your options kind of get more narrow. So I started just seeking out healthcare associated jobs. I was a cashier prior, but I didn't think that the time I was investing in that job kind of benefited where I wanted to go after. And then I did a lot of volunteering in schools. I tutored again for organic chemistry. I shadowed a dentist. I had a lot of friends around me that were kind of doing the same things with healthcare fields or jobs or opportunities. And so that kind of already put me in an environment where I'm getting a lot of that exposure. So at 18, I started joining a lot, and like first year of undergrad, started joining a lot of healthcare organizations. And you can get to see a list of organizations that your undergrad university has. It's typically listed under pre-health or pre-pharmacy or pre-dentistry or pre-whatever. For me, I joined pre-health and pre-pharmacy early on. It wasn't a lot of hands-on experience. It wasn't a lot of exposure. It was just something to at least, if they invite you to come on to see, a panel of pharmacists discussing what they're doing in their day-to-day life, you can kind of get to see where they're at, or at least get to network. So doing a little is actually goes a long way. You don't have to go big on the first time you volunteer. You have to do major events. So I started very small, again, not knowing that I'm going to pharmacy school and almost finishing it. So that's my spiel on that. But it's okay not to know. I changed my major 3 times. I wanted to do pre-PA, and then I wanted to do pre-dentistry. And then as soon as I got in my job, which is what I'm going to talk about later on, which how important it is to kind of get yourself to see what you're doing in order to love what you're doing. Until I saw that, I was just kind of, all over the place with healthcare opportunities. So until I got my job, that it exposed me, okay, to say, hey, pharmacy is kind of where I see myself growing and thriving and doing all of that. But it's okay not to know. I changed my major 3 times. Just don't let that prolong for a long time, so that you you don't like, not regret, but you don't kind of look back and say that maybe I should have taken more health science classes instead of like business or math or law if you're into the healthcare world. And what helped is most of the classes were the same. So they matched up really well. Anatomy, physiology is still required. Chemistries are all pretty required for every single healthcare major. Your general chemistries, everything else. So that kind of didn't take away a lot of time from my schedule. But definitely it's okay not to know. So that's where I started. So just to put a definition, verbatim definition of what pharmacy is, it's an art, a practice, and a profession of its own of preparing, preserving, compounding, and dispensing medical drugs. That's what pharmacists do, in a nutshell. But of course, there's more into that one. When I especially got into pharmacy school now, I found out there's much more into this definition than what it is. And terminology wise is derived from a Greek word, pharmakon, meaning medicine or drugs. And then I put this, basically pharmacy is a person trained to, just read the doctor's handwriting from a prescription. But again, that's besides the point. But pharmacy really is, I would say when you look up a definition on Google or Wikipedia or whatever, it's just described as that, as people who are mainly, they're the expert of their drugs, of the drugs that are out there, whether to manage diabetes, hypertension, all of that. We're the experts that we're able to tell you side effects. We're able to tell you how to take it, how long you're going to be on it, and kind of continuously monitoring how you're doing day-to-day life in and out to see, if you're getting better or things that you need to do to get better. So in terms of branches of pharmacy, there's many. So before, I honestly thought it's just a pharmacist that either works at a CVS or Walgreens around the corner, that counts pills by 5, and goes about their day of filling and just cashing out, and the patient will take their medication and leave home. But it's much more than that. There's community pharmacists, which again are sometimes called retail. And that can be like, CVS, Walgreens, a Jewel Osco, Kroger's, a Walmart, and all of that. A hospital pharmacist is someone who works inside the hospital, kind of taking care of patients that are coming in, inpatient, people who are dealing with diseases, either whether they need IV medications like antibiotics or short-term care, sometimes called acute care. Ambulatory care pharmacists, do you guys know what ambulatory care means before I kind of describe it? Because I didn't know this. I didn't know this before getting to pharmacy school. I thought it's something with ambulance or something. It's weird. But do you guys happen to know what that is? Ambulatory care? You guys can unmute and speak. This is a conversation. Let me check the chat. Umbilical cord, no. Yeah, that's what I thought. I thought it's ambulance emergency, but it's obviously not. No, it's not walking. See, that's not what so ambulatory care basically means you get to have your own minute clinic, sort of speak, like a clinic that's outside of the hospital that's taking care of only one specialty, like disease management. So for example, a patient comes into the hospital, he's having, I don't know, he broke his knee or something, and now he needs treatment, he needs some antibiotics, he needs this and this. That's inpatient hospital pharmacist. Ambulatory care is, let's say you have heart failure and you have, an implantable heart device, right? You can get managed continuously in a clinic where you have constant appointments, constant checkings with a pharmacist that only deals with cardiology meds, implantable devices, heart failure in specific. So you're taking care of even more focused than just generally, we're looking at your heart rate, blood pressure. No, it's more than that. They look at your labs. You can get your labs done regularly every 4 weeks. You can pick up your medications from there. So it's like a clinic that's specialized for that disease state. So you can have a heart failure clinic, you can have a diabetes clinic, hepatitis B or hepatitis, diseases in general, any liver disease in general. You can have an HIV clinic on its own for those patients who have HIV and AIDS. So that's what ambulatory care is. It's basically your own little specialty clinic that you get to run. If you're the pharmacist there, you're basically in charge of all the patients that pick up your medication, that pick up their medications from there. So it's pretty cool. What about informatics? What do you guys think informatics pharmacist is? And that right now in our generation of, advancing technology, it's very much needed at this point. But what do you guys think informatics pharmacy is? Information? Yeah, sort of. Yeah, using scientific data. Yeah. Yes. So it's data and computer. You got it. So it's involving basically the metrics and the algorithm that pharmacists use in the computer to make sure that our way of kind of processing prescriptions, processing their profile. Like if you have a profile and you have, let's say, 3 diseases: diabetes, heart failure, and hypertension. If I'm able to run through your prescriptions and I'm able to, play around with computer data to have the computer pop out to me to say that, hey, there's a drug-drug interaction between these 2 medications to help me as a pharmacist, that's what informatics is. It's really cool. You actually get to make technology easier for all healthcare professionals, not just pharmacy. If you're an informatics pharmacist, you're helping out the surgeon, you're helping out that PA, you're helping out me, the pharmacist, you're helping out everybody, because you're making sure that all the data and information is kind of the algorithm of it and how it's allocated, it's appropriate, and it's catching up all these drug interactions or side effects or some sort. And then home health and infusion basically you don't get to deal with patients. A lot of patients consider a 60-year-old woman that can't really get out of her home. She lives in a nursing home. But most of her medications don't come orally. They have to be IV. You have to have an IV in, and you have to give her that drug. So there are pharmacists that are in charge of preparing, administering, monitoring, calling in those patients who cannot leave their home and have to have IV drugs. So it's very, very important for those patients. Similar with long-term, specialty drugs are different. So there's a lot of, again, many different types of cancers, very different types of viral infections. Specialty drugs are meant for those. They tend to sell a lot of expensive drugs. As you know, there's a lot of insurance problems with payment and all of that, and big pharma. But those medications are very expensive, and they need tailored, monitoring or looking out after for those patients who are taking it. So that's for that. Oncology pharmacist is from the name. You have someone that's specialized to know exactly what every chemo drug does, how long you should be on it, remission cycles, everything in between. So oncology pharmacists are very vital. You'll never find a hospital pharmacy or a hospital, institution that does not have an oncology pharmacist in there, because you need an expert on this subject, on those medications. Nuclear pharmacy is actually pretty interesting, and I have a couple of pictures after to show you that. I went and shadowed a nuclear pharmacist once, and it was pretty cool. It's not the most common, or not most popular, I would say, because you deal with a lot of radiation. A lot of people tend to, not choose that pathway because they don't want to be exposed to radiation as much. But nuclear pharmacy is actually tailored to a lot of immunocompromised patients. Sometimes a lot of therapy, you have to deal with radiotherapy for you to cure something, like Hashimoto's or Graves' disease. Sometimes, they do a lot of thyroid radiotherapy for that. Industry pharmacy is completely different. It's a little bit less clinical. You're dealing with more of advertising the drug, marketing, clinical development. You're attending these meetings to discuss how this drug is going to change, how pharmacists are going to be utilizing that drug, how patients are going to react to it. Managed care, you're taking care of the entire team in the pharmacy department. You're like the boss or the manager, so to speak, of that department. So you take care of a lot of those employee related things. Poison control is actually really cool. It's a lot of adverse side effects are toxic. A lot of drug-drug interactions are toxic. So you need specialized pharmacists to know exactly how to deal with those type of toxicities. Sometimes it can be managed at home. Sometimes you have to go to the ER, and those type of pharmacists are experts at that. Drug information pharmacists are from the name. And then compounding pharmacists are actually really cool because you get to, through talking with your physician and all of that, let's say it doesn't have to be a human, it can be for a cat or a dog. Compounding pharmacists have a background of pharmacokinetics, which basically means they know how the drug will work on a different on human body, but different also on a animal body. For example, you can get to have diabetes medication that you can take orally, but if you compound it into a cream or ointment, it can work for I'm just giving an example, like a seizure ointment for a cat, or kind of an antibiotic ointment for a dog's ear or something like that. So this is actually, you can get to have a lot of leeway with how you work in your environment, because you get to make up your own kind of recipes, or not recipes, prescriptions for it, for that specific drug. So pharmacy as a profession, these are the listed responsibilities. Do you guys think that's accurate? What I have listed here is we dispense prescriptions, communicate with prescribers, ensure patient safety, and counsel patients. Or do you guys think there's more?
I definitely think there's more to it than that.
More? There's more? Okay. Yep, there's more. So a lot more. That's what those 4 things that I listed was what I had thought about it when I was like 19 years old. As that's what I thought all pharmacists would do. Going into pharmacy school, go into the entire process, and now almost graduating, these are the things that we actually can do that I saw doctors are able to do it, but they're not actually responsible of it, because it takes out of their time and it's not something they're experts at. So doctors, I saw, they need our help to do this. PAs need our help to do this. Essentially, all the healthcare professionals, wherever there's a pharmacist, these are their duties. Specialized medication management, specialty pharmacy, outpatient clinics like the ones I talked about, compounding medications. We are the first responders to vaccinations and pandemics. If you go right now, I mean, obviously we're in a pandemic right now. Most of the things that have to be taken care of in the ICU were patients who are not able to breathe, who actually had COVID, reached a really bad level of oxygenation. Nurses and surgeons and doctors were the frontline responders in that aspect. Outside, when you get treated and everything else, we're the ones who take care of you. We advocate for vaccines. We give vaccines. We actually hold a lot of, very primary prevention responsibilities to the public health. So that's one of them. We're able to teach. So a lot of my faculty in Roosevelt University, obviously, they're pharmacists and they're teachers as well. So I would go one day, see them in the hospital. The next day I have them in class. So they're able to do both, and they're very great at it because they're teaching their own expertise on that subject, which is great. Antimicrobial stewardship. Do you guys like if I were to just tug on your brain a little bit, would you guys know what that would mean? Antimicrobial stewardship. And why would you think a pharmacist would do that? Antimicrobial stewardship. Anything. No? Okay. Those are long words.
Because it kind of relates to like educating and promoting or persuading kind of people to not to take antibiotics, but primarily educating of how to take, when to take, and the limits of antibiotics.
You actually hit it on the nail. So it's teaching healthcare professionals, but also teaching our patients. How many times have, I don't know, you or your family member have had to take an antibiotic for something? I have in my life, I have taken a couple of antibiotics for infections or whatever, right? The main thing with antimicrobial stewardship is we're trying to make those antibiotics that work for those infections not as resistant. What I mean by that is we as pharmacists, especially in my rotations a couple months ago, I was in an infectious disease rotation. What that means is that we go on rounds, we see patients in the hospital that have many sorts of infections. You can think of all the infections you can think of: fungal infections, viral infections, bacterial infections, right? And we would go with the doctor and see what type of antibiotic they're on. Like you said, we make sure that they're taking it appropriately for the days and time and duration that they should be on it, because many of the times that I encountered patients, as soon as they take an antibiotic, they start feeling better, even though it was like a 10-day course, they stop at day 5. And our responsibility, and doctors don't do this, surgeons, like you can go to any hospital and ask around, only pharmacists can do this because we do it the best. We know exactly how long does amoxicillin last in your body. We know exactly how long you should be on it for this infection. We know all the side effects. So when it comes to this, and we see a patient that stopped after 5 days because they felt better, we tell them, hey, you're supposed to finish those 10 days, because at 5 days, that bacteria growth is still in there. It didn't decrease, let's say, by 100% yet, only decreased almost 60%. So making sure that we kind of eliminate those problems, we eliminate further active bacterial infections. So you're having like a relapse of a bacterial infection that happened. So if you had some dental work, you didn't finish your antibiotics, your tooth still had an infection after, the main cause of it, statistically speaking, is because you probably didn't finish that antibiotic course to fully treat that bacteria in there. So this is a whole system. I know I put it in a nutshell, but it's a whole big system in every hospital that you go into to decrease relapse of infections. Clinical research, a lot of pharmacists that have PharmD after their name, their actual doctorate degree, still do active research. They still go into every medication that the doctor prescribes, and they still, try to do further research on it, because not everything out there that's published, that means it's 100% published. There's still more room for improvement. And so we take a big leap into research with that. Again, hospital management, medication advertisement, like I said. And the last one is very real, and I saw it affecting my patients. We as pharmacists can go to Washington and actually advocate for pharmacy laws to be changed. I don't know if you guys heard about it, but do you guys know what EpiPen is? Let me check the chat. Yes? Okay. So I don't know if you heard of it, but a couple years ago, EpiPen, yes, EpiPen was not as expensive as it is now. And it's a big push that we're fighting, pharmacists with morals and ethics, and really want to take care of our patients instead of just getting the reimbursement from the insurance and just worrying about the salary and worrying about the money. Those people took that action, went to Washington to kind of debate, argue about the pricing of these EpiPens, because people run into life-threatening situations that this EpiPen is a lifesaver for them. And when it increased up to that price, a lot of patients, again, they have financial instability, socioeconomic instability. They can't really afford. Sometimes they have transportation issues to go to the place to be able to afford that. And so we've really fought hard for the pricing of this EpiPen. And I believe it was almost $600, and $600 from the baseline price that it was at. And it just sparked a huge debate and argument from, again, pharmacist perspective, and then the big guys at the insurance and the reimbursement policies of that sort. So that's something that we, take seriously and still try to, get these things to work, because it affects people's real life situations. You can get to see it. So that's something also big that you can do as a future pharmacist with your degree. So pros and cons list, is it needed? When I made one, I just made a mental note. I didn't write anything down, but as soon as I saw my pros were more than my cons, and I loved the field, I knew it was my calling to do. So some pros: consistent update on medications and disease management guidelines. I cannot tell you how many medications come out every single year to manage rheumatoid arthritis, osteoporosis, diabetes. You guys see the commercials all the time, right? They tell you, oh, these side effects can cause this and this and this, and the patient's like dancing, right? So again, this is just a a tangent, but a lot of medications come out every single year, and we have to keep updated on those medications. And that for me, I guess it's a tiny motivation to say, hey, I always need to keep updated into the medical world to see what's going on. I can always switch the current specialized field I'm in into another one. So for me, that's more for growth. My interests are cardiology and diabetes. So anything that has to do with heart disease and then diabetes on one side, that's my interest. But again, I can wake up one day and say, you know what, I'm willing to invest in another field and maybe take on teaching. I really love teaching. I love making presentations, informing people about certain things. And you can always do that. You don't need to add another degree. You can just have your doctorate of pharmacy, and you can do so many things with it. Creating a personal brand. So since last year, COVID and through quarantine and everything, I saw a lot of pharmacists, with everything being virtual, they really started using social media to create their own brand, and kind of pave their own pathway for success, showing what services they offer, showing their true passion about pharmacy. And that really inspired me to create my own brand one day. Besides everything, just getting the technicality out of it, it has a really good salary. It depends on, again, your position. It depends if you're a manager, if you're just starting out, but in the long term, it builds a really good salary. Let me read some cons now before I finish my pros list. It can be tiring and stressful. Long hour specialty, especially in community pharmacies like CVS, Walgreens, you can have 12-hour shifts, daily, a couple days, in a row. And that can be tiring. It's very demanding in a community pharmacy. You almost like have to work as a machine, but also still like be very accurate. So that's one of the cons if I decide to go that route. And you cannot make really full clinical decisions on your patients because we as pharmacists don't prescribe. We don't have prescribing authority yet. That's actually right now, it's in the process of getting approval. And I predict that within the next almost 5 years. That bill is already in Washington, or that kind of debate is already in Washington. It's already being worked out. Pharmacists should get provider status, and kind of be appreciated or reimbursed for those services that we do for our patients. And then the last one, I just love seeing my patients every day consistently. So instead of walking to a doctor's office for 15, 20 minutes, you leave, your next appointment is in like 3 months or something. I saw my patients, if they had the decision to come every 3 days, I'm able to see them every 3 days and talk to them with no time limit, very accessible. If they have a question about an over-the-counter medication they picked up, I'm able to answer everything that they ask. And so I love that accessibility of that to know how my patients are doing. Sorry, let me just check the chat. Oh, you guys are talking about EpiPen. I'm so sorry. I believe it's a shot. Yes. Yes. Okay, yes. You stab. Yes. It's you guys gave a general, yes. So it is for anaphylactic reactions. What that means is that usually when someone's having either a really bad red rash, itchiness, and most of all shortness of breath, epi it really is for that. Is when you almost are losing your breath. It's not really for allergic reactions that are managed kind of I would say like mild. This is for moderate to severe anaphylactic reactions where you can't breathe anymore. Like, let's say you have a peanut allergy and your throat starts to close up. I've had a lot of patients like that. So epinephrine is for that. So yes, sorry, I didn't read the chat. So my exposure to pharmacy, my job, it got me to talk about or be passionate about and kind of continue on this journey of pharmacy and kind of expanding on my own brand. Because of that exposure. When I worked as a technician, I was able to train, like technicians that came after me. But I started first seeing it as a job, right? But then when you're filling like a certain medication, I don't know, I always had a curious kind of personality. So I would ask my pharmacist, hey, what is like simvastatin, or what is this medication? And he would just give me like a 1-sentence answer and it would stick to my head. So coming into pharmacy school, it made it really easy for me because I knew maybe 90% of the medications on the shelves. I knew what they were for. I just didn't know how exactly mechanistically they work. So obviously that's the schooling for that. But it definitely gave me a big push. Surrounding myself with other healthcare major students, of course, gave me a big push. And I did my own independent research. I hope after you leave this presentation, you leave with something to say. um it's I felt like I was a kid in a candy store because I had so many options. But I hope that after you leave this presentation, you start to think about what you truly like in healthcare. And then one of the reasons I reached out to Sanjana to have this, and prior, I think it was back in March when quarantine first started, I was looking for volunteer opportunities last year because I'm that type of person that always wants to be informed and have my options open. And one thing I took out of it is it's good to know what you don't want or what you don't see yourself doing, so that you just focus on what you're doing good and kind of build on that, because that's where you're going to see your kind of work and your personality thrive in that. So I hope you take independent research in that aspect, is just look up what you're interested in. Don't do it because it may seem cool to do, or envisioning yourself do. Actually go in, apply for a job. If you're an assistant there, if you're a technician there, whatever, like get your hands a little bit dirty to see how it is, to see how the people interact with you, how are you looked at, and things like that. Get a bit of an exposure, even if you don't get a job, maybe shadow someone, and then dive into the field that you want. That's the biggest advice I can give you guys. Preparation outside of school, I networked early on. I always, whether it was social media or phones or phone numbers, whatever, like I just kept in constant contact with people who are like older than me, like 30-year-old pharmacists, I don't know, 30-year-old cardiologists, like doctors and things of that sort. And I told them, hey, I'm a student, I'm really interested. And I always kind of gave them, a time to meet, whether it was online or in person, and just shared what I'm interested in. So if I'm in pharmacy school right now, but if I really wanted to share my interest, I would reach out to, let's say, someone who's taking care of just diabetes patients. So I would reach out to the diabetes director of that program, or something like the big person in there, and reach to him or her directly and say, hey, I would like to see myself in that position. What are the things I need to do? And I can honestly say informally, I can just email them informally, say, hey, what are the things I need to do to get in that position, the position that you're in, or the position that someone else is in? And they're very open to it. You're not losing anything if you reach out early. You're actually only building up your own quality network of people. It's about quality, not quantity. And don't be just book smart. All facets of your personality matter. Going through this, there's a lot of A students, and I was an A student myself. It's not so much that you can take the test very well and ace it and know your things like that when someone asks you. It's about clinical thinking, critical thinking, and overall being a well-rounded person. You have to empathize. You have to have emotions for your patients. They're not people that you can give the medication just for yourself to say, hey, I give a really good medication. He's going to be, his, cholesterol is going to be lower in 3 months. It's really not about that. There's much more to the patient's diseases than you can ever think. So he can have, or she can have cholesterol. If you look further into the patient, they're having that problem because they may be not financially able to afford healthy food. They might not be living in the best area possible. There might be some cultural impact or influence that influences their diet and their lifestyle. So when you dive into more of that and put your empathy towards that, you'll gain more out of it. And people will actually respect you more and appreciate you more for being that type of person versus someone who always gets their medication right. Don't get me wrong, it is good to get your medications right and everything, but that, I would say, is like a 70-30. Most of it is your personality. So what should you expect? Undergrad, you get to choose your classes, times and days. There's more time and more busy work that the teachers give you, and more didactic coursework. In grad school, the courses are already organized for you by terms, unless you're requesting to take them at a different timing. all the time that you need will go into all the work that needs to be done. So there's nothing that's busy work that they give you to just fill in time. All the time that you're going to spend is an investment into your knowledge that you're going to be applying to patients one day. So it's a responsibility. You get a lot more hands-on experience, and you're regarded as a healthcare professional in training. You're not a professional yet, you don't have your license or whatever, but you get much more responsibility whenever you're in the grad world. Let me check the chat. Oh, sorry. So organization is key in both, in undergrad and grad, especially in grad school. You're not going to be babied as much. There's a little higher expectation out of you. You're going to be treated, when you're treated a lot more respect and regard, it's going to make you feel a little bit more responsible than the normal. So just to kind of get into this, and I put in the hyperlink there so you guys can view it after this presentation is done. So requirements to get into pharmacy school, if you're considering it, I hope you consider it at least. PharmCast is the main website to look at the school's requirements, application deadlines, GPA levels, if they require the test, which is called the PCAT. It's all in there. I screenshotted for you. This is the main page that you look at. Then you go into the schools, you pick out the schools based on your state, and the course prerequisites are listed right under there. It's all organized for you. So I picked this one specifically for Roosevelt. Obviously, there's more courses, but I just took a screenshot of the whatever I saw first, and then physiology, chemistry, biology, and it gives you the credits, the quarters, the hours, the terms. So it's all laid out for you there on pharmcast.com. So after you complete kind of doing your research that in there, and you have your mind set on a school and things of that sort, looking to getting recommendation letters early on. I would say in undergrad, the biggest thing I did was whenever I took a class with a teacher, I made sure that I was active in that class, showed interest in that subject. Again, my interest was organic chemistry, but it can be different for everyone here. Kind of they would like, when they see you like that, they're going to give you a really good reference. So it was like a deal for me to make those good impressions on those people, because I valued their opinion. Some schools require a bachelor's degree, but many do not. My school, Roosevelt, they do not require a bachelor's degree. It's a 3-year accelerator program instead of the normal 4. So that's one of the things why I chose it. And then personal statements, they're major key. I think what got me through most of my jobs, my schooling, and right now I'm graduating, and I have a lot of job offers that I didn't expect. Companies reaching out and offering me jobs, is because of my personal statements or what I have on paper. So you're introducing yourself, your story, and you're proving that you're a great candidate despite the papers they're looking at. And what I mean by that, they're not going to look at grades mainly. Grades are important, but it's not the meat and potatoes of everything. Personal statements are really, take your time doing it, talk about your interests, why you decided to go into that field. Involve a little bit of a story that's kind of, influencing you to go into that. So mine was, my mom has hypothyroidism and my grandma has a long-standing diabetes. And I've kind of been managing or tracking how they're doing with these disease management, and seen and picked up my mom's medication and went through the entire process with how that goes. So I already had a story of where I can go with that. So make sure that you nail that part. And then starting pharmacy school, just the last couple of slides here. First year, again, mine is a 3-year program. With all pharmacy schools, the content is the same. And it just may differ on terms, or the course name may be different, but most of the content is the same. So as you can see here, this was my first term. It was in the summer term. It was a lot of biochemistry, calculations, dosages, irregular pathophysiology, teaching you how to be a professional through professional development. I can immunize now. So we got our certificate of immunization our first term. So that was pretty cool. So those are the classes there. Second year, it got more rigorous. So I started taking pulmonary disorders, hypertension, cardio, renal diseases. And then third year, started taking, GI issues, psychiatric and behavioral conditions, hematologic and oncologic disorders. So everything kind of is elevated. So that the higher the years go, obviously the content is going to get a little bit tougher. And then the best part of everything is after you're done with all your all your didactic course, you're free, you're hands-on experience now, you're a healthcare professional wearing that white coat, and you're in the hospitals. And when you walk around, you're looked at as a healthcare professional that has an adequate, not full, because you're not expected to be, the pharmacist yet, because you're still learning, you're still a student. But this part right here, I would say, is the most fun part. You get to explore exactly what you're good at, what you're not good at, what your interests are, what motivates you every day. And this is just some pictures. So I was involved in a lot of organizations in my school. One of them is APHA, which is American Pharmacists Association, and ACCP as well. This right here, I said, is 2 minutes too long of a break, but these are all at different sites. This was actually at a volunteer service in a Spanish speaking community, where we had to go and kind of influence the people there who are shopping or doing their grocery store in that store to kind of pick out more healthier options for their Spanish recipes for food and stuff. So we laid out translated healthy recipe alternative for that, and kind of we had Spanish speaking my friends here, and we kind of just saw people walking in and out, and just we volunteered our time in our service. And this was at Mariano's for vaccinations. We did vaccinations there. So it's just clinical rotations. I think it's where you start applying what you learn. Learning from a book is different than when you're almost, typing in a prescription or sending in an order, and a pharmacist is, which is your teacher, tells you, hey, May, what do you notice about this patient's hemoglobin? And you're like, wait, I learned that. And you start applying it, and you start actually getting good at it. So that's one of my favorite parts. So a couple of the institutions, so I live in Illinois. A couple of institutions I had an amazing pleasure working with, and the opportunity, which is amazing. Northwestern Medicine, obviously it's one of the best, at least in number one in Illinois, but I guess number 5 in the state or in the US. Shirley Ryan Ability Lab, it was a whole rehabilitation hospital. So I was seeing athletes who could not walk for 6 months get recovered. Patients who had amputations, who had, really bad traumas and car crashes, and, had to really go through rehab for a long time. And I was on the pharmacy team there, so I saw all of that. Mount Sinai, so I picked my rotations to be a little bit diverse. So I saw one end of the spectrum, which is a little bit more expensive. People can't afford that rehab. But then I went to a hospital in a very underserved area, and was able to see and empathize with those patients, kind of more socioeconomic issues. And it was amazing at Mount Sinai. And then Northwestern obviously is you get to work with the best of the best in the field. So that gave me a great exposure into things. And at the end, I know went a little bit over time, but it's a rewarding career for me. I saw it. I saw that I gained respect from my patients, my peers, my mentors, and certainly when you work with doctors and surgeons who have been working for 30 years in their field, they look at you as a student pharmacist who's about to graduate, and they're like, you did really well on this intervention, or that was great that you caught that mistake or something. So you get more appreciation as a pharmacist, especially when you're constantly taking care of the things that surgeons and doctors don't have time or the expertise to take care of, which is the medications and the dosages and everything that comes with it. And I'm helping patients, reach a healthier lifestyle day in and day out. So definitely a rewarding career. If I had to go back and do it, I would do it again, maybe take on more opportunities that I missed out on. So yeah, so that's kind of my presentation to you guys. I hope you gained something out of this. I really do. You guys have any questions for me? All right, let me start looking at the chat. How did you get a job as a technician from high school? Were there no requirements involved, like certain classes, skills, or experiences? Great question. So I graduated high school. We had to be 18. So I just turned 18. And there's a website called PTCB. Here, I'll type it right here. PTCB, which is your pharmacy licensing or certifications. So I didn't take any classes. You can choose to take classes, but you can just skip the classes, just study on your own for a certain exam. And I took the exam, I think it was $150 or something at that time. I'm not sure if the price changed, but there comes like a little booklet like this with just the information that you need to know as a technician. And I studied it. I took the exam and then I received my license. So I didn't have to go through classes. You just take the exam. Yeah. Mm-hmm. Can you volunteer at a pharmacy? Yeah, absolutely you can. Absolutely. You can volunteer at any pharmacy. Community pharmacies are all over the place, and I think they're the most accessible. The main two is Walgreens and CVS, which is literally the most famous, I guess, community pharmacies out there. Definitely reach out to your community, your neighbor pharmacist, and tell them, hey, I'm interested to shadow or volunteer to see what exactly goes on to the pharmacy before I jump in it. What did you do for your undergrad? What did you do? What did I do? Like, what things did I? What did you do? You mean like the classes that I took? Kushleen? You guys are welcome. Classes. So it was all the general science classes. I did not have a major. My major was pre-pharmacy. So again, when I took my prerequisites, I got up to the point where I took genetics, was the highest class of biology that I took, and biochemistry, which was a really hard class in undergrad. So I reached 3 years and a half almost of completing my prerequisite work, and then I applied. So I didn't really have a bachelor's. I went to school just taking the hardcore science classes that I needed for the school requirement, and I applied. What was your major? I did not have a major in college. So you can do this with just doing your, hardcore science classes, which are basically, you can do all the courses that I took and apply for graduation and then get your bachelor's degree. I just didn't want to go through the entire thing of graduation, applying for graduation, all of that. I met all the criteria. I met all the classes. And I spoke to my counselor. She's like, you took all the classes that are needed, and you're good to go. What can we do as high school students to inform ourselves? As high school students, to inform yourself. I was just, so I guess in high school, what I was in is I was in NHS. I was in Key Club. High school, I kind of spreaded myself too thin, obviously before COVID. So I joined a lot of organizations, and honestly, not all of them were healthcare, because I wanted to do a lot of things. Again, I was in creative writing. So I had a blog of poetry. I was just very artsy in that. So I just made sure I followed what I wanted, because you don't want to burn yourself out with something. If you have an interest, you don't want to burn yourself out in that interest as much as you can, because that actually can be reversed and you can lose interest in that. So I made sure that I had a little bit of everything around me and just be as genuine as possible with myself. And that kind of entails me going into whatever I like. So find a pre-health organization. And my friends that I've had, I think I was only one of two other other students that wanted to do pharmacy. Others they were all like pre-med or pre-PA. But it helps a lot, because you talk about, like, I was sitting next to a pre-PA student back before I wanted to change my major. And he was telling me, oh, I knew this doctor that, had this shadowing opportunity, and he's 2 streets down from my house. And I'm like, oh, I know that doctor, whatever. So it just builds like a informal conversation, at least. So I would say, how would you educate in high school? Just be around people who have common goals, but different interests. So their goal is healthcare field, but their interest may be PA or dentistry or things of that sort. I think it's good to have those quality people around you. Did you do anything else to prepare for getting into college, classes, shadowing, etc., or was it just volunteering and being a technician? got college undergrad or college like grad? Because college, I applied straight out of high school. I applied to Wayne State University. A lot of my friends were going to that university. It was close to home. It had all the kind of the things that I needed, which is basically some community colleges. The higher up you go with the science classes, you can't really take them there because they don't offer it, or the teachers are not as well to teach it. So when I chose Wayne State University, I had all the things that I needed, and then I kind of went on from there. Shadowing during undergrad, I didn't shadow a lot. Again, I was just really heavily involved in organizations, which made me again see what my interests are. Being a technician again helped a lot. I think that's one of the biggest things that helped me. First, again, I saw it as a job. I'm like, oh, I'm 18 turning 19. I just got this job. I got trained for at least 2 months. And I was just like counting pills in the beginning, to be honest with you, or doing inventory, or, speaking to patients. Hey, how can I help you at the drive-through? Blah, blah, blah. And then I think it's what you make of it, because I had a curiosity into, okay, what is this drug? Why does this look like that? I just was very curious about why, because my patients, for example, they were on 15 medications at once. I was like, there's no way this patient is on 15 medications all at one time. So I just started like being curious about what's going on. Why are they in so many medications? And I just started asking my pharmacist all these questions. And I guess that kind of gave me a big push into knowing what I want to do. Currently, school student wants to go to school after graduating. Are there any extracurricular activities that you recommend that help us? Okay, that's a great question. It's a private question, but I'm gonna answer it. Extracurricular activities that I recommend to help you getting accepted. So I think painting a picture to be a candidate for a pharmacy school, I've been through this so many times. I kind of know what they're looking for. They're looking for genuine people who their interest is not shaken, like they're confident. And it's not arrogant confident. You have to find a line. They love confident people who are not arrogant whatsoever. Be humble, but also boast about what's good about you. Don't be humble to the fact where somebody asks you, hey, tell me about yourself, and you're like, be real, say what you're good at. You're in that room, and I've heard this as a quote, you're in that room because you deserve, or you're meant to be there. So if you're ever at that situation, just know that you're deserving to be in that situation. I've been in interviews where I was actually sitting next to a person who got their master's. I was just graduating from high school. A person who got their master's already. That's a mom that's 30 years old. A person who got their bachelor's, and I'm just here like, okay, I finished my prerequisites. I don't have a degree. And they ask you, what are your weaknesses? What are your strengths? And honestly, you have to be as genuine and as real as possible, because they can, smell that from a mile away. So be very yourself, even if you're like quirky or whatever, funny. Like I was myself the entire interviews, and all, I would say 7 or 8 interviews that I've had, I got accepted to all of them before I chose Roosevelt. And I was just being myself. In terms of extracurricular activities, I mean, a job helped. I guess when they ask, what are your hobbies or interests, really, truly only list something that you actually did. So I did poetry, I played tennis. And so at the interview, they were like, oh, you said you have a blog about, writing poetry, things like that online. What's your blog name? So I'm like, here you go. That's my blog name. Because a lot of people try to like fake the funk out of it, and that really looks bad on you. So if you don't have one, like if you don't have a hobby that might seem cool, just talk about what motivates you. If your family motivates you, if your mom, if your dad, I don't know, where you want to go in life motivates you, you motivate yourself, talk about that, speak about that. That will not go unnoticed. All of those actually is a great step to being accepted. Oh, thank you guys. And at what pharmacy school did you go to? So Roosevelt University, it's in Illinois. It's a 3-year accelerated program. It's a college of pharmacy. The main campus is downtown though in Chicago, but college of pharmacy is like maybe 45 minutes away from Chicago. Oh, thank you guys. I appreciate it. I really hope you guys learned something. I'm glad. What do you recommend high schoolers to get involved in the pharmacy? What do you recommend high schoolers do to get involved in the pharmacy field? High school, you can't really, in the pharmacy field, I would say there's not a lot you can do because A, you don't have a license yet to work or a certificate to work. Again, shadowing is something that you can do because you don't have the responsibility to actually like take care of patients' health yet. Volunteering and shadowing you can do. And I think honestly, independent research is very underrated. What I mean by that is just opening your laptop one day and looking up fields of pharmacy, different fields of pharmacy, and literally all the lists that you have. I had a slide here called branches of pharmacy. You see all of those things, you'll find way more online. And it'll surprise you into how you go about that. So for example, the VA, right? The VA hospital. Pharmacists who work in the VA hospital, you guys should go look into how do they operate on a day-to-day basis. Some actually can prescribe medications. So it's very different. I feel like as a high schooler, there's not a lot you can do because obviously certification stuff, but do a lot of independent researching. And if your heart is not in it, it's good to detect that from the start. But if your heart is in it, I'm telling you, independent research, just nonchalant, you're on your phone, just search up anything, whatever. For me, that benefited me a lot. How has high school changed since COVID? How has school changed since COVID? So during the COVID terms, we had to take, so last March, it was my cancer term, my oncology term, sorry, and my neuro and psych. And those 3 classes, I mean, you can imagine everything cancer related. Like all the drugs of chemo, whether it was lung cancer, liver, heart, or kidney, which is the most common is kidney cancer, or sorry, kidney transplant. When we kind of were quarantining, it was really hard to do it virtual. Really hard. Although it didn't deteriorate my grades that much, but obviously being in person, when I was able to talk to my faculty who's right there, literally 5 feet, 6 feet away from me, very helpful. But I think, I had to put more time to teach myself. Even though our professors were very accessible and we were going to email them and chat with them through Zoom all the time, and they had office hours, it was very difficult because you had to teach yourself chemo drugs. It was very difficult. But I mean, clinical work is clinical work. Now in the hospital, it's very different. Oh, thank you so much. What was your first exposure to pharmacy? My first exposure to pharmacy was my mom's condition. That was the first exposure. It was when my mom actually had hypothyroidism, which means that your thyroid gland is not producing enough hormones to able to regulate your hemostasis in the body. And your thyroid gland controls a lot. It controls your temperature, controls your mood, controls your insulin secretion, controls your stress levels, controls a lot. So always get your thyroid checked. So when my mom had hypothyroidism, she was misdiagnosed for at least 8 months, and the doctor didn't catch that her levels were off. It was very frustrating at the time because imagine, having condition to be treated, but you're not treated for 8 months. And as soon as I found out that she has to be on this medication long term, like for life, and the medication, obviously, if you guys don't know it, but it's called levothyroxine, brand name's called Synthroid. So that medication, typically for those patients, they have to stay on it for long term, because every time you take that dose, you're giving yourself that hormone to be able to regulate your body. So that's when I found out, like, oh my God, my mom's gonna be staying on a medication for a lifetime, it kind of concerned me. I'm like, nobody wants to be on something for a lifetime. So I started, like, my first exposure was the disease condition called hypothyroidism, was the medication called Synthroid. And I did my research on it because obviously I wanted to do it, get the best for my mom. And that kind of intrigued me into how does that medication like keep my mom stable. And it was just this tiny pill. That was my first exposure to actual pharmacy. But before that, it was all organic chemistry. I had fun with organic chemistry. Would you counsel patients? I do counsel patients. I do. Before, I think when you're first year, you have to be supervised. When you're first year student, because you're not exposed to a lot of like courses yet. They don't teach you within your first year. But for because I'm a fourth year now, I'm able to counsel on everything. From Tylenol over the counter to, I don't know, a cancer drug. What would you recommend we should focus on our application to pharmacy school the most? Okay. Deadlines, please, deadlines. Just see what again, those screenshots that I posted here, they really tell you like exactly what the program requires you. So before this, there's like other tabs like listed here, blah, blah, blah. It would say like deadlines, course requirements, like course prerequisites, like the one that you see. It would say GPA requirements, PCAN, all of that. And look at the bottom, it says deadlines. So make sure you keep up with the deadlines. Typically, PharmCast cycles open up in July. And the interviews go all the way until March or April of the following year. And then what you should focus on after the deadlines is focus on getting really good rapport with the faculty or professors that you have in your undergrad school. Build that communication, show that you have interest, show that you're trying to get a higher learning in the healthcare field area. And honestly, most of your professors are, how should I phrase this to be like, most of our professors in undergrad are giving you what they're supposed to give you. If they're teaching you organic chemistry, they're teaching you by the book what they're supposed to do by their job duties and responsibilities. But utilize your professors because they know so many things besides the things they're telling you off topic from, learning about photosynthesis. Like they have a whole lot of maybe 15, 10 years experience in their arsenal that they can give you a couple of references, websites, things to use, people to connect with. So if you have office hours with your professor, say, hey, by the way, I was just, you're an organic chemistry professor. I was thinking about this research project. Do you happen to know who should I connect, or do you happen to know people I can connect with? And you can get really surprised by the information they're able to tell you because they have all these references. They just don't say them unless you ask. So ask for, or have a report so you can get those letters of recommendation. That's the second one. Third one is your personal statement. Like I said, it's major key. Build a story, talk about yourself, talk about truly why it interests you to go into pharmacy. And that will show on paper. If you're going to use big vocab words or to sound a little bit more eloquent, it's going to show they're not going to like that. Be as genuine and vulnerable as possible. That 100%. Call me back, text me back, say, hey, Matt, I got this interview. That will land you an interview for sure. Thank you. What is my favorite thing about pharmacy? Honestly, how much I can like have leeway of changing whatever I want into, like, I can work a couple years hospital. And then if I wanted to move into working in VA, I can go work in a VA and apply. If I wanted to teach, which honestly, that's something I'm really passionate about. Hopefully, as soon as I graduate, I'm applying. I'm in the process of applying for jobs right now. I have job offers already, but I would like to teach and on the side also be a pharmacist. So teach at a college of pharmacy. That's something I'm really passionate about. But honestly, changing whenever you want to grow into something else or change, I'm not changing because I'm bored. I just want to add more, I guess, experience to my to my resume to say, hey, I've had a little bit of everything, so I know a little bit of everything. I'm not sure what the right option. Oh, for the questions, these are options: pharmacy technician, cashier, research intern, CMA. Is studying for the PCAT or PSAT like kind of studying for the SAT or ACT? No. The PCAT, PCAT is the pharmacy exam that most, let me say this, I would right now in this, because everything's updated, 50-50 they require. My school didn't require PCAT, but I had to take it anyways. Because again, I had other options to apply to. I didn't just apply to one. And this is a good thing to keep your options open. I think I at least applied to 15. And Illinois in itself has like 5 schools. So PCAT is not like the other ones. It's, I have a whole, a book. It's the Kaplan book, and I studied it. I took at least 2 months of studying. It was a lot of biochemistry, biology, and things of that sort. A little bit of drugs here and there, like brand generic or whatever, but it's definitely more healthcare knowledge more than the PCAT, or sorry, the SAT or ACT. Definitely much more. You're not gonna get like some weird math equation. No, we're not allowed to prescribe prescriptions. We're not allowed to write prescriptions. But in some states, because we are trying to push that law through of us becoming providers, it's called provider status. In some states you can. So for example, pharmacists in Ohio can actually prescribe written birth control. And I believe in Kentucky, there's another medication they're allowed to do that. So it's not on full medications yet. It's only for a certain thing. People who work in the VA, which is like the highest level you can work in, can prescribe their own medications. It has to be, I think, at least reviewed by 1 or 2 doctors, but you have entire independency to write your own prescriptions. What are your studying tips? Write it. I think writing it down, you don't have to have a calendar. You can just have like a scrap piece of paper and write down the things that you think realistically you can get done within that day. Don't write things like have 10 things and you're able to accomplish 2, and then you feel demotivated after like, oh my God, I just accomplished 2 out of 10. Write it down so you can see it every single day. And break up your work. My thing was, I'm a night owl. I used to probably study till 4 a.m., 3 a.m. Don't do that. Please don't do that. Your sleep is number 1. Going through pharmacy school, doing research projects, going to actual research, conducting my own research, sleep scientifically, factually actually helps you retain much more information than you can ever know possible just by kind of modifying your REM cycle, your REM's sleep cycle, and just take care of yourself. Yeah, don't jeopardize your sleep for that. I use my Outlook calendar a lot. It reminds me like 15 minutes or 30 minutes prior to like an event or homework. My studying tips. I don't rewrite notes, which I saw most of my classmates do, and then we stopped doing all at once. We're like, no, we're not doing this. But most of them rewrite notes on the PowerPoint. I'm like, why are you doing that? It's just the same information there. So don't do that. I would say take a paper. This is what I used to do. I used to take a paper like this. And if the slides were like 50 slides, I would go through every slide, take only the important things out of there and just write it in a very like tiny but readable font, so that by the end, those 50 slides, I literally just have them on a back and forth paper. That's what I used to do. And I just reviewed that note sheet for the exam, and it would, like, just reviewing that honestly would get me like an 85%. Do pharmacists communicate with prescribers? Oh my God, do we not? All the time. You know how many times I have to call to either fix or try to change, do the pricing, or do anything that I can possible to get the prescription right from the doctor. Again, that picture does not lie. My eyes had to get fixated to know how to read a doctor's handwriting. We are in constant contact with prescribers all the time. Is PCAT a requirement? No, it's not. It is not for most schools. A bachelor's degree is not a requirement. Hi everyone. Just okay. To go to Northwestern? No, I did not. For rotations, yes, I did. But not the school. Northwestern Hospital. No problem. Where's the thing? Okay. Oh, no problem. Thank you so much. Thank you. No, you do not need a PCAT for pharmacy school. My school did not require it. A lot of schools don't. Thank you guys. I really hope you enjoyed it. And feel free, I'm gonna put my email. Feel free to email me with any questions you have. Are recommendation letters a requirement for pharmacy school? Yes, they are. Most of these pharmacy schools are looking to see who recommended you as a candidate, and is someone able to speak good about you. So yeah, they like those recommendation letters. Something I never knew was interesting. Oh, thank you. Oh, I'm sorry. I think I sent it through direct. Hold on. Yeah, let me send it to everyone. I'm sorry. Hold on 1 second. That should be it. Was your first exposure as a pharmacy technician? No, it was a couple months actually before I got the job. It was through my mom's condition. Oh, thank you. No, you don't need a PCAT for pharmacy school. Oh, thank you guys. Thank you. I don't know, Sanjana, I don't know, a quiz.
Oh yeah. So for every workshop we have these attendance forms that we implement so that people can get recorded for their attendance.
Oh, okay.
So that's what they're talking about. Yeah.
Okay.
Yeah.
So I should be answering those? Are those like quiz questions? I'm not sure what they're asking.
It's fine. Those are like quiz questions. I mean, I ask that people don't ask them, but
Oh, I didn't know what was going on. I'm sorry.
it's okay. You're good. You're completely fine. All right, everyone, please do keep asking questions. The attendance form was posted. Please let me know if you need it. We can go up till about 8:30 or until May has to go. Up
Yeah,
till whenever.
I'm open here. I mean, you guys are Michigan time. I'm Illinois time, so it's 7:20 near me. I mean, my time. Thank you guys. I really hope this helped. And Sanjan, is this being sent to them after?
Yes, after the presentation, I usually put it in.
Okay.
So for some of the questions, you are right. We go in, and if there's an error on our part, we just give everyone the point for that.
And I want to thank you, Sanjana, so much for this. I feel like I wish I had this when I was their age. I'm not sure if you guys can unmute or maybe speak. I'm not sure if what the age demographic is, but I'm guessing most of it is high school students or first year undergrad, second year undergrad. But I wish I had this when I was your guys' shoes. It would have definitely helped me a lot. So I want to thank Sanjana for this opportunity, and hopefully in the future, hint, I don't know, but you'll see me doing more when I'm an established pharmacist. Not, I mean, we'll see. By May or by July, hopefully, I'm able to produce more content. Oh, thank you. Yeah, hopefully I'm able to produce more content, which will be, presented, I guess, So would it be presented on the main page, Sanjana, if it was a more clinical content?
Yeah, you could, I could like contact them and then we can like set something up, definitely, if it was more clinical content.
Okay.
Gosh, but thank you so much for coming and hosting. I definitely learned so much. I was completely clueless about the field of pharmacy. I just thought it was like administering like medicines at CVS, but
I know.
after this presentation, I definitely learned so much about it.
I appreciate it. Thank you guys so much. Any last
and
questions before I hop off? I'm gonna be here for a couple of minutes. If you guys want
I
to.
had a question about volunteering at like hospitals currently, like during COVID times. Is there like any opportunities that you know of that you can, help shadow a doctor or like be in contact with a doctor so you can learn more about medicine?
Sure. I missed the first part of your question. I got the very like 80% last part of your question. What was the first part that you said?
Oh, is there any way that I can like volunteer at a hospital
Oh,
or
okay.
like a clinic? Yeah.
Okay. So are you a high school? Are you an undergrad, high school?
Yeah, I'm a junior in high school.
You're a junior in high school. I would say volunteering hours, you might not get as much exposure from my experience as volunteering hours. I mean, from the things that I'm seeing in the hospital, there's just a lot more restrictions on the number of people they want on a specific floor, number of people they want in a specific room, in a specific area. So you might not get volunteering, but you might be able to get shadowing. Volunteering basically means like you have to at least wear scrubs or some type of hospital gear. You can follow the doctor and they can have you sit at a desk and do some things.
We're getting kicked off.
Oh, did you get kicked out? Yeah,
Yeah.
you got kicked out. I will contact her. But yeah, as she was saying, I agree with her, like hospitals and like clinics are not taking volunteers and probably not for a good amount of time because of the pandemic. And this is probably same for like the rest of the country, I guess. So everything's pretty much virtual now.
Right. Thank you. Thank you for that presentation. Everything.
Yeah. Of course. Email. All right, everyone, I'm adding her back in. So if you have any more questions, you can all feel free to keep asking. She just got disconnected. All right, everyone, she's back.
Can you guys hear me?
Yeah, we can hear you.
Okay, I'm so sorry. I lost track and I always go off tangent, but my charger my charger died from my laptop. I'm sorry, to answer back to your question. So you can shadow. I'm not sure if the person's still there. Is he still there?
Oh, he's not here.
Oh, bad timing. Such a bad timing.
It's fine. I understand.
Okay.
But yeah, I feel like not a lot of hospitals are offering these opportunities.
Exactly, because I mean, for students, even for us as pharmacy school students, before the let's say Northwestern, they used to take at least 6 students. Now they're taking 4, so even the numbers are like decreasing. So I would say for anyone who's looking to volunteer, where they're in their high school or undergrad, start shadowing first and do it like just see what the institution's hours are. But you can do shadowing, especially, I mean, instead of volunteering for sure.
I had a question.
Sure.
So when you're shadowing, what are you doing necessarily? Like, what are some of your tasks or like, yeah.
Yeah, good question. Shadowing is you're essentially honestly, it's from the name. You're just a shadow to the person that you're trying to follow to see what they do on a day-to-day basis. So, shadowing a pharmacist or shadowing a doctor or anyone, you're there, you kind of, they give you like a badge or something to enter into the hospital or go in and go out or whatever it is. When you're in the pharmacy, obviously you don't need a badge, you just walk in. But when you're shadowing, you're not expected to do any hands-on work. You're not expected to kind of know anything offhand. You're just observing, visualizing yourself in that area and seeing exactly what the doctor deals through, the pharmacist deals through. And if you have questions, you just relay questions. Volunteering, on the other hand, is that you're kind of set to do something at least hands-on, whether it was paperwork, picking the phone. It's a little bit more hands-on than shadowing. Obviously not as much responsibility, but it is still a little bit more hands-on. Shadowing, you're just there observing, legit. You're just seeing what they're doing. That's it. So it's a little bit more laid back.
Okay, thank you.
Mhm. Any more questions I can answer for you guys? Such a bad. I'm so sorry.
It's okay. You're completely fine. I understand. Yeah. All right, everyone. I'm going to go until 8:30 because, well, 8:30 Eastern, because I see about 8 people left on the call. So if you have any last minute final questions, please feel free to ask.
Or you can chat it.
Yeah. YouTube live. I'm monitoring YouTube live also.
So Sanjana, for the YouTube live, it's gonna be recorded there, right? Too?
Yeah, it'll be recorded, but I'm not gonna post it or anything like that. It's gonna be on here, but once the live ends, it's gonna be like taken down and stuff. Oh, you're muted. She's muted.
Sorry, so you're not gonna be posting it for people to look back on it? Like if they wanted to look back at the questions or look back at the recording?
I mean, as of now, we don't, but here, let me